Danielle Siarri, welcome. We're so excited to have you here today. You are the clinical advisor at InnoNurse. You also spent some time at HIMSS. But first, of course, Danielle, we need to take it to the top. Tell our audience a little bit about yourself and the work that you're currently engaged in.
Sure, absolutely. First, I want to say, so nice to see you, even if it's just online. I miss your happy face and your good energy. Glad to be here. And for me, for what I do, I'm a nurse informatics specialist. I have my master's in nursing informatics, graduated at the University of Pittsburgh, and I coded and created a digital open library, basically chock full of health tech and nursing informatics from around the world. Basically just wanted to share what I would find, and as I'm boots on the ground, and just kind of let people know what's happening.
And yes, and now you are quite prolific, Danielle. You are one of our industry's thought leaders. A lot of people come to you, go to you. You're that source of truth for many of us. You've been an incredible leader for many years now, and yes, I do miss your face as well. Hopefully we'll be back in person soon. And so, Danielle, in your time working in the industry, what's the most surprising thing that you've learned about the mindset of healthcare industry executives?
I would say initially, so we'll say we go back to 2009, 2010, just traveling, not just the U.S., I was really surprised about how clinicians were underutilized. Like, you met a few executives that were doctors and nurses, but some countries I would go to, it wasn't commonplace for them, where maybe their nurses were more, maybe like a vocational status. So I would get comments about, why are you using a computer as a nurse? And I was like, well, I'm going to show you how to use a computer as a nurse, and I'm going to have it take me all over the world. So from then until now, I see a lot more nurses and doctors starting their own businesses, running innovation centers that I did not see in the beginning. So I think I was most surprised that people were making products for patients and clinicians to use and not have a single clinician person or even like a patient advocate on their staff to test their product. So that was, to me, was the most surprising. It's gotten a lot better, but I think that was the most surprising.
Yeah, I couldn't agree more. I've been seeing a lot myself, being a serial entrepreneur in healthcare, and now, of course, giving a lot of my effort to Olive and day-to-day, in and out, working to collaborate with nurses and physician executives and watching them come and build products on top of Olive's platform. It has just been exciting to see those trend lines, and you've been at the forefront of it for many years. But then let's also tie in together, and you recently wrote about this, Danielle. You recently had a conversation around building trust in healthcare, which I think there's a lot in what you just described. There's a lot of trust in that in and of itself. But most recently at HIMSS 2021, you led a conversation around building trust in healthcare. What's that mean? What's that mean for all of us? What's that mean more broadly and what you were focused on?
I think it goes back to like my first day being a new grad and taking the bus in San Francisco and going into my first day at work. And there was another nurse on there. I remember her being pregnant, starting a new job, and she just became a lawyer. And she says, remember this, people don't sue their friends. Like, go make friends. So I always would try to be friendly and make friends with the patient. Like, what can I get you? How can I help you? And I just treat everybody like that. What can I get you? How can I be of a help to you? Always looking at what can I do for someone versus what I can get out of a situation. That builds trust across the board. So, kind of just being a nurse sometime, like that title, isn't enough. You have to show that you care and you got a little skin in the game. So I would say always trying to collaborate and find different ways, little different inroads to build that trust, whether it's with a corporation, because really in the end, it's really with that individual, and that connection together, that's what's carried forward. Like, say you're a serial entrepreneur, you build other companies, but if I stick with you and I know, how you are and how you work, you'll always come back and work with me because I've built a level of trust in our interaction. But also online, what I write, what I do, I'm always thinking about the longevity of it. Is this going to be a source of truth long term? Will this, hold up over the next 5 or 6 years? Will this still have something people could really gravitate to and find that's worthwhile and has meaning for them?
No, it's a great point. And in regards to some of the barriers as well, Danielle, there's a lot that can be thrown up, perceived or otherwise, in healthcare, right? Barriers to trust. And it's understandable because of the industry that we're in. But from your perspective, what are the biggest barriers to building trust in our industry, and what tangible actions can be taken to begin to overcome those?
I think sometimes I go in like, hey, I'm Danielle, I'm here, let me work with you. But I've built a name, I've built, something over time. And sometimes I've learned that people are just not always trusting. So even if when I was taking care of patients, I had to convince someone, hey, I have to get you naked and save your life. I know it's kind of like weird, but we got to do this. And then, they're like, okay, like you're totally right. I'm here for a reason. And so you always have to find those earmarks. So barriers that I come across that I didn't know that were there coming from the Bay Area. Sometimes people won't want to work with you because of the way you look. Like maybe, it's an age thing or a race thing or male. Like if you're not in that circle, sometimes people won't let you in. You have to find a like mind that like brings you in and welcomes you to a particular circle. So sometimes there's barriers of people not extending an olive branch to a different thought or a different idea. And sometimes you have to have a little bit of different to create ideas, to create something that maybe you haven't thought about. So I think sometimes people create artificial barriers, and in the end, it's more of a detriment to them than to the other person.
And earlier you talked about, you've been seeing big trends in that physicians and nurses and others are starting to create their own technologies, their own startups. But then also we have an amazing group of startup founders that are out there in the industry and trying to come into the marketplace. Do you see a lot of trust barriers there as well? So think of Nurse Danielle, and here's this brand new startup that Mike just launched. Have you seen barriers of trust there, and how do some of those, or what you have seen, some of those entrepreneurs overcome those barriers of trust, perceived or otherwise?
I think you have to go with like a list of questions. I come with a list of questions. If I'm looking at a product that's already been built or they're in the process, I'll ask them, who's your clinician on board? Can I talk to them? I don't care if it's a nurse or, a radiologist or a lab son, but somebody that's worked on inside of somewhere that understands the clinical workflow and the pain points, and that could let them know like, hey, this is going to work or it's not work. I've seen beautiful platforms created, and then I'll ask the question, did you have a clinician? Like, no. Okay, well, did you research where is your product going to live? Okay, I get your products for the patient. The patient's at a center, you did a good job. But where does this product live? Oh, the product's going to live on the primary care's desktop. Okay, in what country? How many, say in Italy, how many primary care providers are on computers and document on computers because you want it to live on there? Do they have the space? Do they have the capabilities to integrate? So I always say, ask yourself the question, who did you include on the project when building the product? Is it diverse? Did you ask the right questions before you start? Because then in the end, if you ask those right questions, when someone comes to you and say, hey, what about this? What about that? Nope, we took care of this. We took care of that. Oh, we're halfway through this. And then that builds a level of trust because it shows that you actually cared about the end product and you cared about the people that are going to use it.
Well, and you and I have had many conversations on social media or otherwise, and along with our friends. We can't be building these innovations in vacuums, right? We just can't be thinking, oh, there must be a problem here, so I'm going to go build for it. To your point, Danielle, get in the trenches, get boots on the street.
Build it, they will come. Not necessarily.
No, they won't. Not in healthcare. No, they won't.
How long did it take the Field of Dreams for them to build that? Was that like 20-something years? I mean,
unbelievable. I'm
just saying, it took a while for from the thought to actual concept. And who paid for that? Who supported that? That was more of a labor of love than anything else.
But it's so important. I'm glad you brought it up, Danielle. It's so important to get that end user feedback, whether it be a clinician, an administrator, a patient. It's amazing what you can learn when you actually roll up the sleeves, put your boots on the ground, and go and get that feedback for technology and products that need to be built, which then, of course, to your point, leads to additional layers of trust and adoption in the marketplace.
Correct. And it goes both ways. When you're selecting someone, I would say you need a translator. Someone that can listen to the business, the economic piece, the person that can listen to the IT, the person that can listen to the clinician and go, okay, this is what this person said. This is what that person said. Okay, this is what you're saying is completely practical. Okay, no, that's just not going to happen. You got to stop that over there. Like, that's going to be way too financially, and it's really not, you have to know the difference between what someone's asking for and what they really need, what they really want, and knowing the difference between the two.
That's great.
And that builds trust.
Well, let's talk about the positive moments of the pandemic, right? I mean, I've spoken to leaders like you across this country, and we all, of course, recognize how difficult and what a catastrophe COVID-19 has been. However, I think you and I are on the same page that there are positives that are coming out of it, that there will be phoenixes that are going to rise from the ash heap that was this pandemic and that we're still currently in. And so with that, Danielle, what have we learned from COVID-19 that should and will have a positive and lasting impact on our industry?
A couple of things that come to my mind. People would fight telehealth a bit. They would fight video conferencing. They weren't, it was more like a nice to have or afterthought. And now people have embraced it. Things have gotten pushed through, laws and rules that would not have gotten pushed through necessarily. And that people want service when they want service. So people aren't as loyal to situations. They're loyal to the moment and getting their needs met. So I think the market kind of adjusted to that a bit. So I would say the move of the telehealth being more in the forefront has been positive. People, I know people that would fight using video, and that I would try to teach them, okay, you have to use these tools, you have to use that. And then coming to me go, remember when you were trying to teach me that? Like, yeah, I want to learn now. So, okay, let's do it. No shaming. Let's set up time and doing it. And in the end, they loved it. It's really like the bell curve. People got pushed from being a laggard to the forefront of, I got to get in the middle towards more like innovation. So I would say telehealth.
And then also, what do you think the connected home and the connected patient, from the nurse's perspective, what do you think that's going to look like in the coming years? When we're thinking about at-home care, when we see models like a Dispatch Health or otherwise taking care to the home, meeting those members where they're at, that consumer where they're at, and now we start layering on top of, predictive analytics with wearable devices and all of that. Where do you see that going, and is that going to help empower nurses as well?
Well, I've been seeing it for a while in Sweden. In the Nordic regions, they've almost been packaging it that way for the last 5 years, so almost getting a box with a dummy tablet and wearables. And in that culture, they like distance. They like, okay, I'm going to do my 30 days at home and not readmit, and putting on my wearables, responding to the questions on tablet and putting it away versus getting in the car and going to the doctor's office. And I would say Norway is the same way as well. They like the distance a bit and more willing to use the tools, and they have a lot of things set up for senior care as well. So I've seen a couple of pilots a couple of years ago. They did one in Texas on the same model after what I saw in Sweden and Norway. What would help a lot with nurses is anyone could put on a blood pressure cuff. You don't need to have a certain level of education to once you've been instructed how to put the blood pressure on, how to take the temperature, how to upload the information. So that will save a lot of time. You can actually see more people if you can get a trend going before you go and see them. Even just doing a set of blood pressures and be able to send it in and go, I changed my diet, I'm exercising, I'm good to go. So it's a lot of time saver to me. Yeah,
I agree, and I think we're going to continue to march that way. It's amazing to see the innovators out there really pushing it forward in regards to the technologies and the types of devices that they are bringing to market. So, well, Danielle, we're going to start wrapping it up here. Any last parting thoughts, comments, or otherwise for our audience?
Last parting thoughts: read, find information. Read as much as you can and find like minds and have a conversation and learn and share what you learn.
I love it. Well, Danielle Siarri, clinical advisor to InnoNurse, thank you so much for joining today. It was a pleasure and an honor. Always, always great to spend time with you. Thank you so much, Danielle.
Thanks for having me. Appreciate it.